part of discussion. So can you please try to identify the organ given here? Sometimes the question may be identify the side of the organ, side of the given organ. Okay, you will be knowing this is kidney, isn't it? This is a specimen of kidney, right? So can you tell me whether this is right kidney or left kidney? That's my question. Yes, yeah, this is the kidney of, this is the kidney of right side. Okay, this is the kidney of right side. Right kidney is the answer for this question. Okay, identify the side of organ. The answer is, it is right kidney. Okay, fine. So just I want to ask you how I am saying this one as right kidney, because actually right now I am tracing the lateral border of the kidney. Okay, this is the lateral border of kidney, which is convex, and this is the medial border of kidney, which is concave. Okay, which is convex only, but the middle part of the medial border is, middle part of the medial border of kidney will be concave or having a depression. What is that particular depressed part of the medial border? Called as hilum of kidney, isn't it? So hilum is facing medially. Hilum of kidney is facing medially. Okay, and this is the upper pole, this is the lower pole of kidney. Actually, this is anterior view of kidney, right kidney. Why I'm saying this is anterior surface, which is convex. Posterior surface will be flat. Okay, so this is the points for telling the, for identifying the side of the kidney. Okay, so just now I told the two poles of the kidneys, the two borders, the two surfaces. Anterior surface is convex, posterior surface is flat, because it is resting over the posterior abdominal wall. Medial border, at the center, at the middle of the medial border, we have a depression called as hilum of kidney. Lateral border is convex. Okay, and upper pole, lower pole, usually upper pole is broad, lower pole is narrow, but it is not constant. Okay, so by looking at the borders and the surfaces, you can easily determine the side of kidney. Okay, so now I hope you will be knowing how to identify the side of the kidney, right? So now moving to the next question. The question is, what is the arrangement of structures at the pinned area? Okay, what is the pinned area called as? Yes, hilum of kidney. The pinned area is hilum, isn't it? So if you want to say specifically, it is the hilum of right kidney, isn't it? So the sub question is usually structures arrangement. What is the arrangement of structures at the hilum of kidney? Anybody? Are you able to see the structures arrangement at the hilum of kidney, this area? Yes, the arrangement is from anterior to posterior, VAP. Okay, renal vein, V for renal vein, then renal artery, then renal pelvis. So from anterior to posterior, the structures arrangement at hilum is VAP, renal vein, renal artery, renal pelvis, otherwise called as pelvis of ureter. So simply we can remember, pelvis is the posterior most structure, P for P. Pelvis, renal pelvis is the posterior most structure. Fine. Okay. So I hope you are clear about the arrangement of structures at the hilum of kidney, isn't it? From anterior to posterior, renal vein, renal artery, renal pelvis. Okay, fine. Now moving to the next question. Okay, so sometimes the sub question may be, mention the coverings of the given organ. Mention the coverings of the given organ. So what are the four coverings? What are the four coverings of the kidneys? Yes, from inside outwards. From inside outwards, the four coverings are true capsule, fine, perirenal or perinephric fat, then false capsule. The outermost covering of the kidneys will be called as pararenal or paranephric fat. Fine. So this diagram is the sagittal section of the kidney. Okay, showing the, okay, this is the sagittal section of kidney showing the what? The four coverings. What are the four coverings I have told you just now? Yes. So this outwards, the four coverings are: number one, renal capsule, otherwise called as true capsule. Okay. Then just outside the true capsule, we have the perirenal or perinephric fat. Then we have the false capsule. Another name for the false capsule is renal fascia or Gerota's fascia, as mentioned here. Renal fascia or Gerota's fascia. Okay. And what is the outermost covering of the kidney? Pararenal or paranephric fat. Okay? So if the coverings of kidney is asked, I think you can write the 4 coverings, isn't it? From inside outwards. Fine. Yes. Now moving to the next possible sub-question for the kidneys, they may ask the relations of the kidney. Relations of the kidney. Okay. So before moving to the relations of kidney, see this diagram. This is the right kidney and this is the left kidney, isn't it? This is the IVs, sorry, this is the inferior vena cava, this is the abdominal aorta, isn't it? So as we discussed just now, this is the medial border of the kidney, right kidney, and this is the medial border of the left kidney. Okay, are you able to see this is the area called as hilum of kidneys which are facing medially, medially, isn't it? Okay, fine. Let's move to the next specimen. Yes, again, this is the anterior view. Okay, so again you are seeing the right kidney and left kidney. Fine. This is a part of inferior vena cava. This is a part of abdominal aorta. This is the left renal vein I am marking now, which drains into the LRV, left renal vein. This is the right renal vein. Okay. So you are able to see a part of ureters, only a small part of ureters. Okay, right ureter and left ureter. Okay, fine. So now coming to the another possible sub-question for the kidneys, relations of the given organ. So for that you have to identify whether it is right kidney or left kidney. Okay, so this diagram shows the anterior relations. Okay, anterior relations of right kidney and the left kidney. So just remember the names of the relations. Okay, the 2 main anterior relations of right kidney will be H and D, hepatic area, duodenal area. Okay, and the 3 main anterior relations of left kidney will be PSG, pancreatic area, splenic area, gastric area. Okay, then the 3 common anterior relations for both kidneys will be suprarenal area, colic area, jejunal area. Okay, so remember the 5 anterior relations for right kidney and the 6 anterior relations for left kidney. Fine. Yes. And if they ask, okay, so this is what again I have mentioned the anterior relations of right and left kidneys. Fine. Now moving to the posterior relations of the kidney. Sometimes posterior relations of kidneys may be asked. Okay, so almost the posterior relations of both kidneys will be similar. 4 muscles, 3 nerves, ligaments, 2 ligaments, 1 or 2 ribs. Okay, so go through the various structures: diaphragm, psoas major, quadratus lumborum, transversus abdominis. These are the 4 muscles located behind the kidneys. The 3 nerves are subcostal nerve, iliohypogastric nerve, and ilioinguinal nerve. The 2 ligaments, medial and lateral arcuate ligaments, 1 or 2 ribs. Both kidneys are related to 12th rib. Okay, and left kidney, because it is slightly at a higher level, right kidney is slightly at a lower level. That otherwise we can say left kidney is slightly at a higher level, isn't it? So left kidney not only related to 12th rib, it is also related to the 11th rib. Fine. So this is about the posterior. This is about the posterior relations of both kidneys. Fine. Yes. So relations of kidneys we have studied, and please remember. Okay. Please remember. Sometimes they may tie this structure. They may tie the ureter. Okay. Sometimes ureter may be tied. Okay. So, and the subquotient for the ureters may be, okay, length of ureters. What is the length of ureter? Yes, it is approximately 25 centimeter. Okay, about 25 centimeter. And what are the 2 parts of the ureters? Yes, Upper part of the ureter is called as abdominal part, which is located in the abdominal cavity. Okay. And the lower part of the ureter is located in the pelvic cavity. So it is called as pelvic part. Okay. So these are the two parts of the ureters. Okay. And the usual sub-question is, what are the constrictions of ureters? Mention the constrictors. Okay. Mention the constrictions of the pinned structure, tied structure. Okay. Constrictions of the tied structure. Can you tell me the three normal constrictions of the ureters? Yes, you can see in this slide the three normal constrictions of ureters. What are they? First constriction is called as pelvi-ureteric junction. Okay. The first constriction is located at the junction of renal pelvis and ureter, called as pelvi-ureteric junction. The second constriction is located at the level of pelvic brim, where the ureter crosses the common iliac artery, Fine. And the third constriction of ureter is located where the ureter pierces the urinary bladder wall. So what will be the name of the constriction site? Yes, vesico-ureteric junction. Okay. Actually, that is the narrowest constriction. Among the three constrictions, the narrowest constrictions of the ureter is what? Vesico-ureteric junction. Okay. So I hope you are clear about the three normal constrictions of the ureters. Fine. Yes. Now, remember, sometimes in spotters, the trigone of the bladder, okay, trigone of urinary bladder may be, that area may be pinned. Okay. Trigone of urinary bladder may be pinned. Okay. Okay. So take care of the boundaries. Okay. Boundaries of trigone and features, peculiar features of the trigone of the bladder. Okay. So as you see in this diagram, okay, this is the trigone of the bladder, this triangular shaped area. Okay. So trigone is an internal feature of bladder. Okay. It is an internal feature of urinary bladder. Okay. It is a feature of internal feature of urinary bladder. So the base of the trigone is formed by interureteric crust, interureteric ridge or interureteric crust. The apex of the trigone is formed by internal urethral orifice. Okay. Apex of trigone. Fine. Base of trigone, apex of trigone, and the lateral boundaries of trigone will be formed by uretero-urethral ridges, as you see here. Okay. Base is formed by interureteric ridge. Apex is formed by internal urethral orifice. Lateral boundaries will be uretero-urethral ridges. Fine. So boundaries of trigone you are clear. Base, apex, and lateral boundaries. Okay. These are the three boundaries of trigone. When you talk about the peculiar features of trigone, see this slide. Okay, at least try to remember two things. The trigone of the urinary bladder is derived from mesoderm. Okay, because trigone is derived from one embryonic structure called as mesonephric duct, which is mesodermal in origin. And at the level of trigone, submucosal layer is absent, so that mucosa is tightly or firmly attached to the muscular layer. So mucosa will be smooth and glistening. Okay, and it is lined by transitional epithelium, otherwise called as urothelium. Okay, so then one more is uvula vesicae, is an elevation produced by median lobe of the prostate just behind the internal urethral orifice. So at least remember any two peculiar features of the trigone. Okay. Yes. Now coming to the few questions related to the duodenum and the pancreas. Okay. So this is the specimen of duodenum and pancreas. So right now I am highlighting the outline of what? Which structure? Duodenum, isn't it? This is the duodenum. Fine. So this is the right side and this is the left side of the given specimen. Okay. So what are the various parts of duodenum? We have D1, we have D2, we have D3, and we have D4. These are the 4 parts of the duodenum, isn't it? Then, if they ask the parts of pancreas, what are the various parts of the pancreas? Are you able to see the pancreas in this diagram? Yes. So this is the head of pancreas. Right now I am marking the head of pancreas, which contains one projection, the one I am drawing now, called as uncinate process. And other parts of the pancreas will be what? Other than head, it contains neck, body, and a tail. Okay, fine. So this is the head of pancreas. This is the uncinate process. This is the neck of pancreas. Okay, this is the body of pancreas. This is the tail of pancreas, which comes in contact with the hilum of spleen. Hilum of spleen, isn't it? Okay, fine. So what are the possible sub-questions for this? Yes, they may pin the duodenum. Okay, duodenum may be pinned. Duodenum may be pinned. Okay, so they may ask what are the parts of the pinned structure. Okay, then what are the internal features of pinned structure? That is second part of duodenum may be pinned. Okay, otherwise they may ask the blood supply of the pinned structure, or pinned organ. Okay, fine. So let's discuss this one. You know the parts of the duodenum, you know already. What are the 4 parts of the duodenum? Yes, D1, D2, D3, and D4. That is first part, second part, third part, and the fourth part of pancreas. Sorry, fourth part of duodenum. Okay. What about the interior of D2? Yes, this diagram shows the features of interior of second part of duodenum. For spotters purpose, just to remember the part. Just to remember the 5 topics. Okay, so one is major duodenal papilla. Number 2, minor duodenal papilla. Okay, minor duodenal papilla. Number 3, plica circularis. Number 4, plica semicircularis. Number 5, plica longitudinalis. Okay, so the 2 main features are major duodenal papilla and minor duodenal papilla. Okay, this is the major duodenal papilla in this diagram. This is the minor duodenal papilla. Then plica circularis will be there, and 2 more are plica semicircularis and plica longitudinalis. Okay. Then coming to the blood supply of the duodenum, one more possible sub-question is blood supply of duodenum. Okay. So this diagram shows the 4 parts of duodenum: D1, D2, D3, and D4. Okay. So remember, the duodenum is supplied by the 2 main arteries, namely superior pancreatico-duodenal artery and the inferior pancreatico-duodenal artery. Fine. This is enough actually. Okay. Duodenum is supplied by, okay, if you want to say specifically, duodenum is supplied by anastomosis between anterior and posterior branches, of superior pancreatico-duodenal artery and inferior pancreatico-duodenal artery. Okay, extra information. Okay, superior pancreatico-duodenal artery is a branch of gastroduodenal artery. Inferior pancreatico-duodenal artery is a branch of SMA, superior mesenteric artery. Fine. Leave this one. So just to take care of this one about the blood supply of duodenum. Fine. Yes. Sometimes related to the pancreas in the specimen, they may ask the parts of pancreas, parts of the pinned structure. Okay. Otherwise, blood supply of the pinned structure. Okay. What are the parts of the pancreas? Yes. The 4 parts of the pancreas, as you see in this image: head, neck, body, tail. These are the 4 parts of the pancreas. Okay. Other than 4 parts, the pancreas contains 2 projections called as processes. What are the 2 processes of the pancreas? Yes, one is called as uncinate process. Another projection, small projection, is called as tuber omental. Fine. Yes. Now coming to the blood supply of the pancreas, one more possible sub question: out of the 4 parts of pancreas, You know, the head and the neck is located within the C-shaped concavity of duodenum. So whatever the two arteries supplying the various parts of duodenum, they will also supply the head and neck of pancreas. Okay. So the head and the neck of pancreas will be supplied by the anastomosis between the anterior and the posterior branches of what? Superior and inferior pancreatico-duodenal arteries. What about body and tail of pancreas? The body and tail of pancreas will be supplied by the numerous pancreatic branches of splenic artery. Pancreatic branches of splenic artery. And one more possible MCQ question, for MCQ purpose, I have added this one. The largest pancreatic branch of splenic artery is called as Arteria pancreatica magna. Magna means largest. Okay. So Arteria pancreatica magna is the largest pancreatic branch of splenic artery. So that's the end of the current spotter session discussion. Okay. So we have discussed the various questions related to the possible questions related to the kidneys, ureters, okay, urinary bladder, then duodenum and pancreas. Okay, duodenum and pancreas. Thank you all.